All right, so Mama Jaclyn, ADH1 caregiver to Annie and a patient herself.
Good afternoon. My name is Jaclyn. When I was asked to speak, I immediately said yes, and then I got the topic of my treatment, and I laughed. I've lived most of my life without treatment, and I wasn't diagnosed until 2017 at the age of 40. Growing up, I was taught to never give up, that I have the potential to reach my goals. Work ethic and perseverance will get me anywhere I want to go. My 4 older brothers ensured that. I just need to work harder. I must not be working hard enough. A daily thought that I had for athletics, school, work, and later parenting. I was the tomboy chosen first at recess for teams. Coaches looked at me as an above average athlete. I was an athlete. What I didn't realize was I was having severe muscle pains, body aches, and random other strange symptoms that affected all aspects of my life. No one, not even myself, knew how crappy I felt. How hard I was working on a daily basis just to have a normal life. I justified, adapted, persevered, and I had a mindset to improve what I now know were my hypoPARA symptoms. The impossible was standard of care. Like my daughter, I questioned teammates about recovery, sleep, and diet. I must be out of shape. The day came, and I was offered a D1 soccer scholarship. I turned it down. I remember I was purely exhausted. My collegiate workouts were much harder, nursing school was strenuous, and instead I had signed an ROTC scholarship. This was my life as I knew it. I had no idea I had symptoms to even report. I was an active duty Army nurse from 1998 to 2006, living the Army life. I would often joke with my soldier friends that my heart rate increased well over 100 just to get to the mailbox. When working out, my heart rate would be between 150 and 180. My arms fell asleep and my muscles cramped. Then I would just go to bed. I often had headaches lasting days or reoccurring in the afternoons for weeks on end. It must be me working all those swing shifts. I finally was seen by a provider. I reported my exhaustion, inability to concentrate, and lack of motivation. I didn't know I had other symptoms. I was treated for depression and anxiety on and off since age 23. With my pregnancies and breastfeeding, I had a relief from my silent symptoms. I often commented to my husband how I wish I could be pregnant and breastfeeding my entire life. I had no idea. I finally felt great, happy, and I had energy. In 2013, my provider suggested that I add a multivitamin with calcium to my diet. I was informed low calcium is pretty normal for women my age, as well as living in upstate New York. I was unaware I had had low documented calcium since 2002. I lived in Hawaii for 6 years. I had the symptoms. My quality of life continued to worsen, and I became more symptomatic. In 2017, while my husband was still on active duty, we moved to Tacoma, Washington. I had fought off being that patient, a wife of a physician, a nurse, and that woman who was that hypochondriac. I had reached my breaking point. I knew something more was happening, and I no longer could persevere through my silent symptoms, and I didn't know I had. I told my husband I either needed to be admitted to the psych ward or had a brain tumor. Walking upstairs was causing me to be out of breath, and my heart rate would increase to 180. I was sleeping constantly, yet waking up in the middle of the night with headaches lasting weeks. I wasn't even able to run half a mile. I had a follow-up medication check for my antidepressant scheduled. Instead, I had an EKG and labs. I was finally going to see an endocrinologist. My calcium was in the mid-6s. Finally, at 40, I was diagnosed with idiopathic hypoPARA and hypocalcemia. I had genetic testing done, and it was determined that I had the calcium sensing receptor mutation, otherwise known as ADH1. I was prescribed the standard of care of oral calcium, active vitamin D, and also hydrochlorothiazide in hopes to keep my urine calcium lower. I was told to preserve my kidneys. To preserve my kidneys, I had to keep my calcium levels as low as possible in the normal range. I was taking calcium supplements around the clock. I was taking up to 5,000 milligrams of calcium. My urine turned cloudy, and my symptoms still were there. What person would feel great living in a low normal range for anything? No one. I was on the standard of care for 6 months, and then I was prescribed NatPara. NatPara worked lovely for about 4 to 6 hours a day. Each afternoon, my symptoms would reappear, and I would just take my calcium. In 2019, the FDA recalled the NatPara. I was back to popping pills every 3 to 4 hours, waking up in the middle of the night, and being told not to take more calcium because my urine calcium was so high. I have to protect my kidneys. The current standard of care does not get me anywhere near having a reasonable quality of life. My life revolves around taking pills, blood draws, without my symptoms improving. My mind revolves around determining what I ate, how I slept, what activity possibly caused some of my symptoms. Exercising exhausted me, brain fog, I have anxiety, mood changes throughout the day, headaches, paresthesia. I was unable to work, and I was actually feeling ill from the calcium supplements. I got to the point of not reporting any of my symptoms. I know my providers care, but there was nothing else that they could do, and I know them personally. I can only compare this condition to type 1 diabetes in insulin. We have an endocrine disorder, and we have no hormone replacement like insulin. Our therapy can cause more damage than good. Our lives revolve around labs that are suitable for a normal person. We guess if we're high, we guess if we're low, we take a pill, then we wait and see how we feel. If not, and if we're wrong, we guess again. We're always trying to play catch up. I couldn't give up and accept my physical or mental state. Many do with this condition. I had to become my and my daughter's advocate for managing and treating the low calcium. I sought out medical trials to participate in to advance any treatment for the hypoPARA community. I attended the hypoPARA Association conference in Denver in 2019, and that's when I started my outreach for possible trial opportunities. 2 years later, 30 minutes apart, I was presented the opportunity to be in 2 different trials. I had hit the jackpot. Now to make the decision. I ultimately chose the trial that I believe would not only help myself in my quality of life, but more importantly, assist the entire hypoPARA community of children that should never, ever have to experience hypocalcemia symptoms. The trial medication is not perfect, but I no longer suffer with daily endless symptoms. My quality of life has drastically improved. But what if there could be more? What if it could be better? The more medications and treatment options providers have to assist in optimizing everyone's quality of life needs to be done. I'm grateful that there are options on the horizon. This needs to continue. Our children deserve it.
Oh my goodness, that was wonderful, sharing all those different stories with us. And really, thank you all for putting it all out there and doing that. So let's give it up again for the panelists.